So we'll talk a little bit about some of the newer diet, I guess. Well, I'm not going to call them fads, but like trends, especially intermittent fasting, Mediterranean diet, maybe keto, paleo. Everybody hears all these words. Like, what's probably the best diet for you? Which that I think, like Sharon and I were talking, is probably more individualized. It doesn't. There's no one diet that's the best for any one individual. But in 2016, this Japanese biologist Yoshinori Oshumi won actually the Nobel Peace Prize because he was able to prove that fasting activates autophagy, which really what that means is fasting allows your body to almost regenerate itself. I hear people and patients ask me all the time, well, what can I do a cleanse? Can I do a detox? There's really not anything out there that really does a cleanse or a detox, but intermittent fasting might possibly do that. We find that during fasting, our cells actually break down proteins and other components of the cells. They destroy damaged parts of the cells. They may even repair some of the DNA. And this helps the cells live longer. It helps you have more of a cleaner cell line so that you have less diseases, less inflammation. And there's even evidence now that actually may even help reduce certain cancers as a result of cleaning up the cell line. You can keep going.
So along those lines, there's a nephrologist, Dr. Jason Fung in Toronto, and he realized that all of his patients that he was treating were on dialysis or close to it and getting worse and worse, and didn't have the means to buy healthy foods. And so he's saying, okay, well, then just stop putting the sugar in. Just stop eating. Literally. And he has since progressed to writing an excellent book on intermittent fasting if anybody's interested. But he knew that there was some science out there, and he actually saw some of his patients during Ramadan with their blood sugars and their insulin levels lower. So he thought, let's try this. And there's all different extremes of time-restricted eating or intermittent fasting. Cynthia Turlow is a nurse practitioner, and she says, just start gently by maybe pushing out a 12-hour fast. Okay, you have dinner at 7 o'clock, you go to bed, you get up, you have breakfast at 7. That's a 12-hour fast if you didn't sneak in ice cream before bed. It's a 12-hour fast right there. So what she's saying is just maybe push that morning breakfast out a little bit more, maybe an hour at a time until you get something that might look like this. So before noon, all they have is coffee, hot tea, water, and then from 12 to 8, you eat your meals, and then after 8 p.m., you stop eating again. So this would typically be called a 16-8, 16 hours of fasting. Fasting is when you're eating or not eating, and then an 8-hour of feed when you're feeding. And what does this do? It stimulates the autophagy you talked about. It lets your insulin calm down during the time when you're in a hyperinsulin state. We had a patient that came in for research about 3 weeks ago, and she wanted to qualify for a study. She had to have an A1C of 9.0 or less, and it was 9.3. So I kind of went and talked to her a little bit, and she had about a week left before the study was going to fill up. And so she left, and she didn't really want to get rid of any of her carbs just yet. So she left, and she said, well, Sharon, I thought about it. I was already fasting because I had to be fasting for the blood work, and it was almost 11 o'clock. So she then just did an 11 to 7. In there was fast food, lasagna. Again, she didn't really want to get rid of the carbs just yet, but she did 11 to 7. She came back in 8 days, and her A1C dropped 0.5 points to 8.8. Now, everybody knows that A1C is an average blood sugar over 3 months. So incredible results in a short time that there's a lot of studies going on and more's out there. So, stay tuned.
Yeah, this is a great slide. It shows you definitely the pictorial of the patients in the top who have the increased waist circumference. Their lipids were elevated, blood sugars, blood pressure, and just by not eating 4 additional hours a day, look at the difference in their body physique. The top people were having food, 14 hours of eating, 10 hours of fasting, whereas the bottom only ate food 10 hours of the day and fasted the remainder 14. And they had a lot lower body weight, lower waist circumference, lower blood pressures, lower bad cholesterols. The A1C dropped. They probably felt better, had better sleep, probably more energy. And 4 hours out of the day is probably not really a lot to ask for. If you maybe tag on a couple in the evening, couple in the morning, I think it's definitely doable. I think many of my diabetic patients ask me, though, is intermittent fasting okay with me having diabetes? And I think unless you're a type 1 brittle diabetic patient whose blood sugars are just up and down all day, I think it's definitely ideal for the diabetic patients to do this because it will help not only lower your sugar, your insulin levels, it'll help your organs function better, and it's totally doable in the type 2 diabetic patients. Majority should not be having the severe hypoglycemia. And if you do, we can adjust down your medications because if you can make the changes through lifestyle, that's the best way to do it versus any of the medications.